Hello, everyone, and thank you for joining me this time. This is Nurse Vicky with Petra Home Care. And today, as we are wrapping up this month of October, which is a breast cancer awareness, I really just want to share a little bit on that, on breast cancer, and how we can help each other and help people around us, that we can prevent this type of cancer, or how we can help those who are actually going through the cancer, through breast cancer. So this is Victoria with Petra Homekit. And I'm going to share my screen, guys, just some facts about breast cancer. So I'm going to share my screen here. So come along with me. All right. So it's all about breast cancer. Breast cancer can start from any part of the breast. It can start from one and it can be both breasts. And this also is not only limited to women, all right? Though it's most common, most prevalent among women, but at the same time, men do. Yes, men do have breast cancer. So, for females here in the United States, breast cancer is the most common cancer after the skin cancer. All right, so after skin cancer, breast cancer is the most common one for female, for women, and also is the second leading cause of death. All right, after lung cancer. All right. So it's the second one that is very common after skin care, after skin cancer, and also the second leading cause of death after lung cancer. And here are some facts about breast cancer. All right, so here are some risk factors, all right? And I always tell people there are some risk factors that you cannot change. These are things that this is part of who you are and you cannot change them. But then there are some things that you can modify. So number one, being born female, like myself, being a female, I am at risk. Men are at risk, but women are way more at risk because we have new breasts here and there and all of those. So that is one of it. Getting older, the more you age, the more you are predisposed to things like that. Personal or family history. So if breast cancer runs in your family, then there are chances that you might have it down the road. If your mom, if your grandmother, if your sibling, if any of those people have it, then there are chances that you might have it. I remember a while, many years ago, Angelina Jolie, she's an artist. I mean, this lady, she's an actress and all of those. But because she had in her family, I mean, this is very common. And with that, she knows that, what, she is probably going to have it or not, but, to just kind of limit and reduce her chances of having breast cancer, she had to go for mastectomy, just really taking care of the breast so that she doesn't have to deal with breast cancer. I mean, no, people can take a radical step and people don't have to. But there's some things to be aware of. Inheriting gene changes. Yes, if you have family, that means you might inherit some of the genes that may cause this breast cancer. Or if you start your menstruation very early, yeah, maybe like from age 10, 11, even 9, sometimes we see things change these days. So if someone is starting early menstruation or having a very late menopause into the late 50s, early 60s, then they might be at risk. Having dense breast tissue, and these they can find out when you do like a screening mammogram. They can tell you if you have a dense breast tissue, and this is very common. The dense breast tissue is very common among African women, the African Americans, or having radiation to the chest. The more you are exposed to radiation, the more you are at risk, and having some benign, breast conditions. So all of those things are risk factors. So if any of this applies to you, you may want to do screening, go for mammogram, and do all of those things to just make sure you are, you are really want to prevent things Know that you are checking yourself and you want to intervene as early as possible. All right, so there are some lifestyle related risk factors of breast cancer. We talk about the things that you can modify, and then there are some things that you cannot these are some things we talked about things you cannot modify, all right, like your age, being born a woman, having family history, dense breast tissue, all of those. But here are some factors that you can actually modify. They are life-related risk. Drinking alcohol. So if you are such a person that drink a lot, you might want to reduce that. Being overweight, obese, especially after menopause, or you are not physically active, getting hormone therapy after menopause, or never having children or having first child after age 30, all right, and using certain types of birth control. So that some of the factors too that may actually make you put you at risk for breast cancer. But if you have any of these, it doesn't mean that you're going to have breast cancer. It just kind of give you an awareness so that you can do self-check, breast exam, and go for your screening, your mammogram screening if you're age 40 and above, and just follow all of those things to just minimize the risk. All right. So what can you do? We're talking about this, avoiding or limiting alcohol, being physically active, getting to a healthy weight and staying there, maintaining that healthy weight, and consider genetic counseling. That means if you have a family history of this, of breast cancer, if it is common in your family, then you may want to consider genetic counseling to be able to know your chances and what you actually need to do. Remember, there is no sure way to prevent breast cancer, but some risk can be modified. Some might cannot be changed, but some we can actually modify, like stop drinking and all of those that you can modify. All right, so let's continue. Screening now and early detection. In one of the things in breast cancer, or even with any sickness, any disease, is the earlier we cut it, the better treatment can be started and the better the process of healing and recovery. But if some things have advanced, and we know cancer can advance rapidly or metastasize into other parts of the body or the organs, and then that may complicate healing or complicate things. So screening and early detection is the key. So women ages 40 to 45, 44, please start your yearly breast cancer screening with a mammogram. I remember a few years ago when I turned 40, right? My doctor recommended that I have that. And since then, I have been doing it every year, every year. And I don't have family history. And I have friends that have no family history and like in their late 30s, mid-30s, they develop breast cancer. So sometimes, it's just about having family history. You may never have a family history, and then you have breast cancer. So once you turn 40, please, if you haven't gone for that yearly screening mammogram, I encourage you, please do and do it. You have insurance, it covers for it. It is a preventive measure which is covered whichever type of insurance that you have. You don't have to pay anything for this. And most of the time, you do it yearly. And some even earlier than 40, you may have to do screening if you are being a major at risk, you have a higher risk of it, or if you started feeling some lumps, on your chest. All right, then you may want to really go early to do that. Women 55 and older can switch to a mammogram every 2 years. These are recommendations, or they can continue the yearly screening. There is no right or wrong to this. If you are 55 and every year you do it and there is nothing, and you have no family history, of course you can switch to every other year. But if you still want to keep doing it every year, your insurance cover for it. So talking about mammogram, right? Mammogram, is something, there are major places that you can go to have a mammogram. They do all the testing, press your breast against all this metal just to really screen it. And I think in few days, you get the result. They will send to you, and they will send to your doctor, to your gynecologist. So they will send to them so that you can know what is going on. And depending on what they found, you might need to do further testing. If they found anything on your screening mammogram, they may have to do MRI and do all the other stuff. All right. So signs and symptoms right now, for breast cancer, all right? These are things that you may notice. That is why we recommend that every month, especially for women, that you want to perform breast self-exam. Yes, you can do it. You press against your breast. You go in circle all around both breasts. You may do this maybe first day of the month or whichever way that you are doing it. And if you notice anything ordinary that like this is not normal, whatever is not normal, it is not normal. It needs attention and it needs intervention. So if you found a new lump, found something there, or mass, that is signs and symptoms that need attention right away. Swelling of all or part of the breast. All right, Factor, you don't feel any lump, but if all of a sudden you are not breastfeeding, none of those, but you see that your breast is swollen, it needs to be attended to. Or skin dimpling, all right? Changes to the color of your skin, all of those, nipple pain or retraction, though the nipple is drawn in, anything that is out of the ordinary, that is unusual for you. And that is why every month you want to do breast self-examination on yourself as a woman. And if you are a man, listening to this, encourage the women in your life to do it. Remind them, have you done your breast self-exam this month? Or if they need to get their mammogram, if they are age 40 and above, encourage them to go get it. Another sign and symptom is a nipple discharge. If you are not breastfeeding, nothing, and then there's something coming out of your breast, you need to see someone. Or nipple or breast skin that is red, that is dry, that is flaking, that is thickened, everything that is really not normal, on your breast, they need intervention. They need to be further screened, just to make sure what is going on there. Do you need to further test it and see what is going on, and do you need to start treatment right away? All right. So treatment for breast cancer. And let me just put a disclaimer out there. I forgot to say this. I am a registered nurse. I'm an oncology nurse. I do not diagnose, all right, but I help people that have cancer, any type of cancer, but I do not diagnose cancer, okay? I am a registered nurse. So treatment for breast cancer depends on the type and stage of the cancer, all right? That is why they do all of the screening, they will do further testing, biopsy, and different things to be able to know what type and what stage the cancer is. And depending on the stage, we determine the type of treatment that they would do, all right? So people who are diagnosed with breast cancer should discuss, all right? Like I said, I am not diagnosing anyone or giving treatment, but you must discuss all your treatment options, with your healthcare team, your oncologist. Discuss your options with them. They are great at telling you what is going on, what to expect, what is best for you, all right? And then we help you in the process, all right? So that is all. So as we wrap up Breast Cancer Awareness Month, please make sure you are checking on yourself. Check yourself, check the people, check on the women in your life to say, have you done this? Have you done that? And if you notice anything out of the ordinary, thing that is unusual for you, enlargement, color change, discharge, pain, lump, mass, please, those need attention right away. And if you are age 40 and above, and you have not done your screening mammogram, I encourage you to go for it. And now, if you have someone who is going through breast cancer, everyone's journey is so, so different. What you can do is to be present with them, is to be very, very supportive. One thing that we found out is for breast cancer, if it's detected early and is treated early, people recoup and they go back to their normal life. Some treatment may include surgery, some may include chemotherapy, radiation. It depends, right? But most of the time, people do recoup depending on the type or how aggressive the cancer is. But if you have anyone going through it, what you need to do is to be available for them, is to provide support, to encourage them. There may be time they are weak, there may be time they are down, there may be time they don't feel like doing anything. But having people around them, encouraging them, supporting them, will really help them through their journey. All right, so if you need help or you need someone to talk to, we here at Petra Home Care, we can gladly help you. All right, so please follow us and reach out to us. Actually, we have a special program for those for cancer patients. Yeah, so reach out to us to know more about that. Again, this is Nurse Vicky with Petra Home Care. We are an agency that provides support and assistance to those in need, and we cover the Houston area. Thank you so much, and you have a wonderful time. And don't forget to subscribe. Don't forget to subscribe, like us, and share this. All right. Thank you. This is Victoria, not Vicky. Have a wonderful one. Bye bye now. Shalom.